general dermatological face examination. Wonderful. Hello there. I was just reading your report. Welcome to the skin examination room. Please come in and take a seat. Thank you. Welcome to my dermatologist's office. I am Dr. Clear for Clear Skin. Pleasure to meet you. Okay, that is how you pronounce your name. And looks like we have a general face and skin examination today, correct? That's what your report says too. May I please double check the spelling of your last name? Thank you. And is your residence the same from your last report? Okay. And what is your birthday? Okay. And finally, is your pharmacy the same as last time? Okay, it has changed. Let me write that down. I might have to prescribe you some skin ointments or medicines depending on what we see here today. So, welcome to the exam room. There are very good lights shining on your skin right now that help me clearly assess your skin. It's beautiful, by the way, but I do see where you would want to get an assessment for. Yeah. So, okay. Now, before we begin, I have a couple questions I need to add to the computer. And the first one being, how do you feel about your skin? Okay. Understandable. Have you changed your face wash recently? Okay, and face lotion. Okay. This is the biggest one that could cause a rash or flare-up. Have you been wearing sunscreen? Okay. You have to wear sunscreen. And I mean lather it on. Seriously. And any changes in your diet? Okay. So, now that that's all typed in, I'm just going to look around your face with a light. May I touch your face? Great. General look at your skin. So, I'm just going to poke around. Going to look as particularly at the area that I see that might need some extractions. Okay. Just going to take a better look. Okay, a little bit of a stubborn area. Your skin otherwise looks very clear. There might be some issues with dullness and particularly dryness around the mouth. This can be caused by a change in temperature or face wash or lack of sunscreen. And, okay, just a quick flash at those areas. Okay, I will be continuing this examination now with a cleansing. So let me get that. First, I'm going to apply a alcohol wipe to your face, certain areas. I want to make sure that both the skin is clean so that before I work, it's not going to spread anything. So examine the most, so I'm just going to pat it around. So just okay, looking good. Now I'm just going to quickly just pet around your face, little pokes and pets here. If it hurts at all, please let me know. Just going to just poke and pet around, just okay. Looking a bit deeper into your skin. Yeah, this area looks to be a bit sensitive. Understood. I'm going to write that down really quick. Okay. Next, I'm going to actually measure the area, and I won't be touching your skin, but I'm going to measure the general area of the one I'm going to be treating the most of, so try not to move, okay? Thank you. Okay, so I would say it's a little bit of a rash and some spots. Nothing wild, but I could see why that could cause some concern. So just generally measuring around that area. Okay. Okay, and it also appears to be a bit dry, which could cause a bit more of activity, so we gotta fix that. Yeah, nothing too extreme, but I'm now going to do a thorough look with a little magnifying glass at the area and around other parts of your skin to compare it to. So again, just gonna get a bit close here, and we're just going to see a bit. Okay, I'm just going to poke around there. Does that feel uncomfortable at all? No? Okay. Just going to take a closer look here. Poke around there. Now to another part of your skin that's different. Just going to look around. Just going to poke around there. Just going to look around there. We're going to flip the side a bit. We're going to shift the focus around your face. Just shifting the focus around your face. Okay. So, what I conclude is that you have some dry patches here and also a little bit around the sides of your mouth. So, what I'm going to do now is, since the area is clean, I'm going to use a sterile applicator and apply a very intense acne treatment to these spots. So, Now, before I continue to apply it, I have to apply an ointment prior. This is just an antibiotic. Just a bit. We're just going to take a bit of that and apply it to the applicator, just like so. And I'm just going to just dot it on the area, and we'll also make it not feel any pain because I think I will also be doing some extractions. Just going to dot, 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 okay. Good. Letting that sit, I'm going to prepare the other objects here. So, I have this. It is an intensive peel of salicylic acid. We're going to apply that to the applicator. It's very strong, so okay. This might dry the skin out a bit, but I'm going to also apply to the back of my glove. And I'm going to do spot treatments on those areas. So it might just sting a little bit, so just please stay still. We're going to press and hold and press and hold, press and hold and press and hold. Grab a bit more. Just applying. Okay. Now that that area has had medicine applied to it, let's do some quick extractions. These will not hurt. I already applied an anti-pain ointment on your area, on your forehead. So what I've got here is a bit of a dermal abrasion machine and an extraction tool. So I'm just going to gently just touch the areas that would require a quick extraction, and then I'm going to use the tool to extract. So please do not move. If it feels uncomfortable at all, let me know. So just going to cause a quick abrasion, just and do the other ones that need a little bit more help. Okay, that didn't hurt? Great. Now with a wipe, we're going to just prepare the area. And I'm just going to gently press on the area. Okay, we're just going to wipe, press on the area, and wipe. Just going to press on the area and wipe. And last but not least, press on the area and wipe. Wonderful. Some areas require some removal because it would be easier to treat the area once we have removed some of the stuff inside the pores. So I'm going to quickly write that down. Okay. And there doesn't seem to be any problem or disturbance in your skin there. So let's let that part heal, and let's move on to the rest of your face. I have some super soothing products, so let me go grab them. Let's treat the rest of your skin now. You just had some dryness in this area, and I would say a bit of dullness, so let's bring that back to your skin. I have a lot of fun products for that, by the way. What we're going to do first is we're going to apply a water-based serum with hyaluronic acid. And the hyaluronic acid acts as a moisture locking solution to your skin. Acts sort of like a humectant, which will keep moisture in and make your skin look plump and help it rebuild. So I'm going to take a bit of that onto my gloves here. Just a bump. All products being non-comedogenic, so they will not cause acne or flare-ups in the skin. So we're just going to pat that around, especially on your dull areas. So super gently going to apply that. And now just pitter pattering. Great. I know it can seem a bit silly, but the way you apply product actually helps it into your skin. Following the treatment, we're going to use another water-based serum before we apply carrier oil serums. This is a life savior. Vitamin C serums will help with dullness and perhaps help with the tone of your face. And this one is very nice for daily use. I'm going to take a couple dots of this, 3 to 4, and it will also help with luminosity and uneven skin texture. So, same as before. This one also smells really nice. So, it smells like a light lavender. So, I'm just going to dot that on. And now we're going to actually sweep it up into the cheeks. So great. And last but not least, the final serum. This is actually a retinol. And what this will do is it's going to help with the general health of your skin. It can help with wrinkles. It doesn't really do that. But what it will do is it will help with the healing of your skin. So this one requires a little bit less. 1, 2. Just going to take that. And this one we're just going to apply to the drier areas. Drier areas of skin can get wrinkles more easily, so we want to prevent and protect. So I'm going to sweep that up. And we're going to let that sit in now. This one requires the least amount of work because it works stronger. Your skin looks luminous and flawless. Do not worry about the redness on the area that we treated. That will be taken care in no time. In the meantime, I'm going to write you a prescription for a vitamin C serum, a hyaluronic acid serum, an anti-acne cream and perhaps a little bit of ointment for that more intense area, okay? Great. Remember to wear sunscreen, especially when using acne products, because it can cause flare-ups if you do not protect your skin. Your skin can also react more. So, I'll send this into your pharmacy as well, but here's a copy of it. Just take it in with you. Great. And I hope you are feeling better in no time. And trust me, you already look amazing as it is. I promise you, you will feel better soon, okay? Thank you for coming on in. Have a great rest of your day and enjoy your night.